to be an introduction anyway. So welcome everyone. Thank you for being here today. Today's webinar is being presented by Northern Policy Institute, or NPI. And before I introduce our invited discussants, I wanted to talk a little bit about NPI and also give some housekeeping notes. So let me just change here. Okay, so NPI is, for those who don't know us, is Northern Ontario's independent, evidence-driven think tank. We perform research, we analyze data, and disseminate ideas. Our mission is to enhance Northern Ontario's capacity to take the lead position on socioeconomic policy. Our permanent offices are in Thunder Bay at Kirkland Lake. I'm talking from Kirkland Lake today. And we currently have a satellite office in North Bay. And in the summer months, we have satellite offices in northern regions, other smaller communities of Northern Ontario, and they're staffed by our experienced North placements. So those are 4-month placements for university students and college students too. So I'm talking from Kirkland Lake. I wanted to recognize the traditional lands in which we work, live, and play. And so I wanted to acknowledge the First Nations in the territory in the Robinson-Huron Treaty, in which we are here right now in Kirkland Lake, and also all the others from where you were joining. So a little bit about our agenda. I'm going to give a quick introduction to the subject, and then I'm going to ask our invited discussants to share their experiences and give their insights on the topic. That's going to take around 20 minutes. And after this, we're going to open the floor for a conversation on the 2 main questions and their implications. We have around 40 minutes for that. At that point, we invite all participants to join the conversation, talk about their own experiences, and freely discuss the subject. So I'm using the term invited discussants because all webinar participants are, for this webinar, considered as discussants. So the goal of the webinar is to spur conversation so everyone can jump in, turn on your microphones and join the conversation. And we invited some discussants that we believe have great insights on the topic and to kickstart the conversation and inform it as it progresses. So with that said, I'm going to go to some housekeeping notes. Patrick, my colleague, is taking a look at the chat. So feel free to reach out to him if you have any questions, any technical difficulties, and just to answer some common questions, you will have access to the presentation afterwards. So this presentation is being recorded and it will be posted on NPI's YouTube channel afterwards. So you also have access to that, and the presentation itself will be available on our website. After the meeting is over, NPI will summarize some points discussed in the event to inform some future work, such as a possible event summary, or to inform some possible future publications. So just that we'll take notes on it, but it's not very transcribed or anything, so don't worry. So thank you for being here, and I think we could start. So let me just change here. I'm working with one screen today. Okay, so just a quick introduction on the questions we are proposing for discussion today. So this webinar is part of a larger project on digital literacy, and it's formed by one publication that is being reviewed right now and 2 webinars. One of them was hosted in December 2021, and now we have the present webinar. The first webinar discussed the limits of internet connection itself. So which services could be delivered in Northern Ontario if we had perfect internet, and what were the challenges for that. So for this webinar, we want to see the other side of the coin. So the assumption is if everyone in Northern Ontario had a perfect internet connection, are there services that still cannot be delivered online, either completely or partially? Or is there services that lose something? So is there something lost when these services are delivered online? That can be due to multiple factors that you're going to see in the conversation. So that's the other side of the coin. So I just wanted to stress, like, it's not a problem of internet connection, it's more of the services themselves, like what is lost and the types of services that are not ideally perfectly delivered digitally, so they can be over phone, over internet connection, and so on. Okay, so let me change my screen here just to introduce our invited discussants. Thank you for being here. I'm very excited to hear from you all. So first, we have Dr. Rensha. He's a rural generalist physician at the Marathon Family Health Team and also a professor at Northern University. Then we have Julie Harmer. So you don't need to speak in this order, but just to introduce you. Secondary school adult education specialist at Seven Generations Education Institute. We have Leanne Mail, Chief Executive Director, at Yes Employment Services, North Bay. And we have Vernon Ojima, Employment Navigator at Seven Generations Education Institute. So we talked briefly before. I know you have great insights, but so that everyone knows, this is not a panel. So there's no preset questions. There's no Q&A session. So this is going to be very natural. The goal is to have a natural conversation. So our invited discussants have not talked to each other before. So apart obviously from Vernon and Julie, unless they hosted a secret conversation I'm not aware of, but so that's the goal, just so you know. So, and also there's no Q&A session. So if you have any questions, any inputs, feel free to jump in as much as you like at the open conversation. So that said, I'm going to open the floor for our discussants. And I'm just going to put on the screen the questions proposed. So here we go. And now, who would like to start? If nobody volunteers, I'm going to volunteer you. So
I can start, Brianna. Morning, everyone. I'm Julie Harmer, and I'm currently in Thunder Bay, working out of my classroom for Seven Generations. I'm probably not going to talk for a full 5 minutes, or maybe I will. So since obviously the start of the pandemic, there's been a huge move to deliver educational services online. During the pandemic, I was lucky enough that they left my site open, and so I would get on Zoom for 3 or 4 hours a day. The students all had the link, and in a year and a half, not one single student logged on to it. So in my experience as a secondary teacher, and particularly with adult education, most of my students, they come because they want to earn their grade 12, but that's not why they come. It's the reason that they get here, but the retention is a huge issue for adult students who have lives and children and jobs and all kinds of other responsibilities and things that they need to think about. And so it's the connections that they make here. Sometimes it's a lunch program or getting time with other students or adults outside of their homes, right? So that gets lost when they are online. And it's also a really specific kind of learner that does well in an online environment. And it isn't most of them. They have to be able to navigate online. And so when you're looking at things like essential workplace and literacy skills, you have to first teach them to use the platform, which can be difficult. remotely, and then sort of, and there are blended models where, they might sit and listen to you talk for a little bit, which becomes more of a lecture than it does an interaction with students, right? When you're presenting things online, if you can get them to turn their cameras on, like that's that's a difficult task. And so they end up really having to do things independently because they don't want to reach out. They're not comfortable. They might text me. My students are more likely to text me or message me over Facebook Messenger than they are to actually connect over a Zoom meeting, right? So it's a very specific kind of learner, and there are a host of programs that it's not effective for when they have to do hands-on stuff. You're going to teach hairdressing online, like, so there are certain programs where the limitations are really, really blatant. And then, but I think that for most students, that a huge part of education is all of the things that happen when you're not reading a book and answering questions. So a lot of that is missing in a digital environment, especially for the students that I have experience with. And I'll stop talking there.
I'm going to jump in next, seeing that we are from the same organization. I'm Vernon Ogama. I am the partnership advisor for 7 Generations. A lot of the stuff that Julie's talking about, I can echo. I don't think there's not too much more that I can add to that, except for the fact that when we are looking at group facilitation stuff, getting the people to leave their cameras on is very difficult. And so when we ask that, it almost sets up, we have to de-escalate that confrontation sometimes because they have other things that they want to be doing while they're listening to us do our facilitation. So learning a whole different set of skills when it comes to group facilitation online is something that we would have to train our frontline staff on, in being able to understand what that social piece is in that digital world. For most of us that have built a career in facilitation or working with groups or one-on-one counseling, we use a lot of body language. We use a lot of that energy from that group to understand where we are going to take that group, because most groups aren't always the same, right? So and then especially with the age differences, if it's the young people that are on the workshops, they get frustrated real quick with us older people because us older people are asking questions to the facilitator, and we automatically think that the facilitator is a technician, and how do I do this and how do I turn that on and whatever, right? So there's a whole different set of skills that we will have to learn going forward in that digital world, unless we have a person with us that can answer those technical questions. And like Julie was saying, the biggest problem we have is it's not so much with the academic part or the theory part. It's the actual practical work. It's non-existent. If a lot of the pre-training programs that we have to do to get a person ready for a certain skill or a certain job, it has to be hands-on. Like, just the top of my head, like maybe like chainsaw, learning how to like run power tools or a chainsaw or what, that has to be in person. So anyways, that's what I can add to that.
So maybe this is a good time for me to jump in, because I think the environments or the client groups could be similar as with the last two individuals speaking. So I have been in the sector for 27 years. I am a CEO, but I did start frontline, so group facilitation, doing workshops, public speaking. So I have a lot of experience actually doing the work, but now as I move towards looking at design, program design, what becomes really lost in the conversation about can a service be delivered online? And I can tell you, with an excellent facilitator, an excellent teacher, you can speak and you can get the service done. But the question is, especially with vulnerable populations who we work with, who have difficulty in social situations in the workplace, we're getting them ready for the social interactions in the workplace. And you cannot live that through an online service delivery. Online service delivery is passive. You all are sitting there quietly, so lovely, engaging some of you with eye contact, but some of you, I don't see your faces. And this is what's happening when we're talking to youth. And I got to tell you, there's sometimes you log off to a youth workshop, they're not logging off because they left 2 hours ago. And the thing is, yeah, you can give the knowledge out and you can be a really great speaker and you can engage, but unless they are actively engaging on the content and you are having dialogue and you are challenging and you were asking them about their perceptions and their ways of thinking, are they really learning? Or are we just delivering a service because we need to say we did it? So what are we here for? What's the purpose? And the purpose is to make a difference in people's lives. And if you think of it that way, you need to give them the right kind of platform to challenge those cognitions. There's a reason why people struggle. It's because the thinking patterns aren't exactly the way maybe perhaps they could be thinking. And I'm looking at all your half of your beautiful faces, but I'm not challenging your thinking patterns right now. And you're all adults. You might be thinking about what I'm saying. You might be thinking about what you're going to say next. And I think when it comes especially to youth, that social learning is key. And I got to tell you, there's so much research out there about youth during the pandemic and marginalized youth with disabilities who became more depressed, who became more isolated. And what we're experiencing is now to overcome social anxiety post-pandemic is incredible. So getting them into our offices is a little incremental step into getting them into the world. And that's learning that is not formal or informal. It is learning by incidental. You're teaching them something without them actually knowing it. And I'm going to stop here because I'm sure you all have a lot to say. And I know that I pretty much passed my 5 minutes, but that's probably the main theme that I was here to discuss.
Good morning, everyone. I guess I'll go next. Shane Fisher with Human Knowledge Genuine. And you know what, going back to what Vern said, and a lot of these things, you need to read people's body language and how they're holding themselves. And like Leanne said, having your camera on, you know, just so we're paying attention. I apologize, Vern, because yeah, my phone kept buzzing and I had to respond to an email right away, and it does get distracting, and we're all guilty of this. I know that for a fact. I've been on many of these Zoom or team meetings and that, but being in person speaks volume because we need that interaction back and forth, and that's just like Leanne had spoke. And it's so easy for people to be disengaged on these things, and I just wanted to agree with that. Thank you.
Okay, folks, I think I'll go next. And maybe I should have been part of the first webinar because I'm having an unstable connection this morning. So we'll see, Brianne, if I fall off, I'll try to hotspot and get back in. So my name's Ellie Orantia. I'm a rural generalist physician in Marathon, sort of halfway between Thunder Bay and Sault Ste. Marie on the North Shore of Lake Superior. I am going to use my 5 minutes because there's lots to talk about here when it comes to virtual care. I'm a rural generalist, which means I provide care from birth through labor and delivery to death, through palliative care and medical assistance in dying. And I provide care in some of the many other adventures that happen between those bookends. When it comes to virtual care, I'm going to give my definition. It's essentially the modalities, or some people would call them channels, that you can use to interact with patients outside of the face-to-face in-person visit. So there's synchronous, which would be video or phone, and there's asynchronous, which would be text and email. And we're involved in using all of those. And these have existed for quite a while. This is not something that's brand new, but through COVID, what's happened is there's been a migration in the healthcare system to those platforms. And some of that has been very much government encouraged, because what they've done is that they've created some billing codes so that physicians could then bill for virtual visits, so on video or on phone, where before they couldn't. So there's been that impetus to move to that platform. And like any tool, there's both the negative and the positive, the challenges and the benefits. I'm going to try to be a bit of a balanced position on those. So my function as a rural generalist is numerous, actually. So I am a diagnostician. I try to figure out what the medical health issue is, what's the disease state that the person has. I am a patient counselor, I'm a patient educator, I'm a coach, and I'm a cheerleader. And the virtual platforms are really amenable to many of those. It's great to be able to, even after hours, reach out, contact a patient, have a brief conversation, get the information across, meet their needs, meet my needs. And that's really effective. However, when it comes to the diagnostic part, virtual just does not fit the bill. So history is really important in trying to figure out what's happening for a patient. But let's say you've fallen and twisted your knee and you've got a sore, swollen knee. Well, you can tell me about what happened, but I'm not going to be able to tell you that it's ligaments or meniscus or bone or soft tissue unless I actually see that knee, feel that knee, do a physical exam, right? And so virtual just falls flat in that area. And then what happens is if I don't do an appropriate triage around the virtual visit and we talk about your knee, I'm going to have to book you in for an in-person visit. And then the challenge there is that erodes a really important resource, which is access. Other people aren't going to be able to be seen because we've got to have that second visit where it could be one and done. So that's an issue. Email and text are great for really dense information communication. And that's easy. You can access it whenever you're able to. It can fit into your day. The challenge at a systems level is that if there is unmet need in the system, which we know there's a lot of demand right now. If you open those channels of communication and you don't really think about how you're doing that and how you're going to manage that, that demand is going to find those channels and it's going to pour in, and it can be overwhelming. And we have had this inordinate, just an epidemic of burnout in healthcare, and it's paralleled COVID. And this could very much be one of those pieces that adds to an individual's burnout. So it's something to be really cautious about in managing. I have to say that there are some really great resources that have happened for us through virtual care. There is, for instance, if I'm in the hospital and I'm managing a really sick patient and I'm, at the limit of my skill and knowledge, we now have availability to contact quickly our tertiary resource center. So Thunder Bay for us, Thunder Bay Hospital, talk to the ICU, and they can put an intensive care specialist on video with me in the emergency room where they can see the patient directly and give me real-time advice and care, and even set up to have them transferred to their facilities. And that, especially for new physicians trying to work in rural and remote areas where you're isolated and sometimes the medicine is overwhelming, this is a really important piece of retention, which is so critical to the health human resource issues of the rural north. When it comes to patients, really it's about access. It's ease of access. That is the biggest thing that virtual has created for us. And if you're stuck at home, you've got mobility issues, you can reach out, you can get care. If you're busy, you're working all the time, you're 2 weeks in, 2 weeks out, you need to talk to someone, virtual allows you to do that with minimal displacement and challenge in that space. There are issues, though, around this for patients, and I very much see it in my older population. Many don't have computers. Many have smartphones and they use it like a brick, like I use. They don't know how to use it. And so there's technology and the hesitancy around technology, the inability to use technology, and then the fears around technology. You know, I'm on video with you. Who else is listening? You've probably had that Zoom experience early on, at least, where there was that phone number on your Zoom and no one knew who that was, right? So platforms have gotten better, and but there's still the questions about confidentiality and privacy. The other piece that's really important that people have touched on as well is the marginalized folks, the folks that have those really incredible needs. I provide care for the community of Net-Mazagamig, and it is not uncommon for my patient not only not to have access to a computer, but they don't have access to a phone, you know, and that's a blatant issue of equity if we're funneling resources into virtual when there are these marginalized groups that cannot access it, right? So we're not doing a good job on that. I do have to say that virtual does save lives in the health field. You're all Northerners. You all know Northern highways. We're 300 kilometers away from Thunder Bay. People sometimes get called in for a 5-minute post-op appointment with a specialist. You know, you travel 600 kilometers on an icy winter highway. That adds up. The risk is there, right? And having telehealth where you can get on the video at your local hospital and talk to your specialist for those 5 minutes, I mean, in the long run, that makes a difference, and that's important. I think the core issue that I work on, and many of you as educators and support folks that help our communities is about relationship. And there's something, and I think Vernon has talked to this, and there's something about that Leanne has mentioned too, that, you know, you're missing something about that human interaction. There's something about being face-to-face in person that has, you know, the body language that you're missing out on when you're virtual, just the touch, the whole experience. There's something missing that doesn't allow you to establish rapport and relationship like you can face-to-face. And that's not so concerning for many of my patients that I've known for years and years and establish those relationships, but especially for new folks, transient individuals, people that you've never met before. There's a difference in the relationship and therefore in the healthcare that you can provide. And that's why I hesitate. And in my own practice, I'm face-to-face as much as I can be. I'm virtual somewhat. Video, very little. Phone, quite a lot because it is effective and efficient. And text, our clinic texts, reminders, I don't text, and emails, very little and in specific circumstances. So that's my reality, and I'll stop there. Thanks.
Thank you very much. Thank you all for sharing about your insights and your experiences. So now I want to open the floor for all to turn on their microphones, turn your cameras on if you like, and join the conversation. So, and just to remind, just as a reminder, invited discussants, just feel free to jump in again, please. I know 5 minutes is not enough. So there you go, to you guys.
Maybe I'll start. So I'm Lucy Peros. I'm the executive director of FedNor, which is an economic development agency for Northern Ontario, so federal government. So we work with businesses and we work with communities for growth, you know, we'll try and get growth anyways. What I'm seeing, you know, is that the digital experience has really increased access. So access for, you know, rural communities, access for equity, access for stakeholders. You know, you can have, you know, where before you'd have maybe, you know, 2-3 people in a room because it's expensive to get to some of those areas. Now you can have like 10 people and you can have, you know, more access, I guess, in a way. And it's more structured to some extent, you know, on that front of it. And it doesn't build relationships though, and it doesn't build, the collaboration. So it's way lower cost to do business, and you can get a lot more done. But what I'm finding is that that's kind of come at a cost, right? A cost of, people's well-being, like you can work steady, right? So there's no sort of downtime while you're traveling somewhere, or you're, like having a coffee with someone as you're, chatting, whatever. So there's less, at least in my world, less work-life balance, because there's, people, you're accessible all the time. Right. So when people, especially in this economic environment, where you have businesses that are really struggling, and they're desperate, right? So they're reaching out like at all times, right? And it's accessible. So that I find is a plus and a minus at the same time, on the accessibility side. And then it's easy to be bold when you don't know the person that's on the screen beside you. You can just turn off your screen, and as opposed to having someone beside you. So the discussions, and the tone of what happens when you're in a room is different than when you're online in doing that. So that I find is a different skill that you need to learn on how to manage that piece of it. And then I want to say, I think we've lost some of the longer term relationship building, which leads to, planning, collaboration, regional development, in my world, on that side of it, we're missing some of that as well. And I'll just share a personal example of some of the things. Like I have meetings with people all the time, and now it's easy because I see your name there, Brianne Roca. Okay, I see your name. But then when I get to a session or a conference and I see you there, chances are I'm not going to remember your name because I saw you and along with 10 others on the screen there, different than if I had met you in person the first time and said, hi, the next time I know you, right? Like I would remember you. So I find the relationship building is, it happens, more access, but it's a slower pace in order to do that. So anyways, my thoughts.
Maybe I'll just jump in because, I'm sorry. On just jumping on the conversation about that relationship building and what Alicia was talking about, I think there's a place for that one-on-one conversation to happen, and it can really bridge some gaps when it comes to service delivery. You can have those in-depth conversations individually. It's as soon as you start to get groups of people together that that opportunity for connecting, like you said, just sort of it goes to the wayside. Because I mean, just look at what Rachel and I just struggled to, our voices is speaking over each other, right? Like when you're in the middle of a room and you're in person, that kind of stuff, you can have a chuckle and it builds relationship. But online, it's like, oh my God, was I rude to just keep on going, or somebody had to, so it's a completely different dynamic. And I got to say, what it's done to people, I don't know, before COVID, you could have you would not have 5 meetings a day before COVID, because you had to travel between meetings. You had to take a break between meetings. But literally, we went from being very programmed to not programmed to go during COVID, and now differently programmed after. And the impact on our communities, our marginalized populations, we have to be reflexive on how that impacts them differently from how it impacts us. And we have to understand that not everyone comes to the table with the same sets of skills. So the impact is disproportionate on those that are marginalized. We tend to now expect more from people, and more intensively. So I think it's something to reflect on.
It's funny you're talking about in-person meetings and that sort of thing. And it just occurred to me, like, at the end of this, everybody is going to leave the room. Nobody is going to say, I'm not going to say, hey, you know what? I really liked, Leanne, what you said. And then we have a half-hour conversation and now my network has grown. She's saying lovely things and I'm really on board with it. But at the end of this, I'm going to leave. I'm not going to get that connection with her. Or somebody who was quiet and I saw them doing something that I can go over and say, hey, and then start that conversation because they only do one-on-one, you know, like sort of all of the things that happen after the content. And it's like, it's great that we can provide the accessibility for those things. And we can tick our boxes and say, we're more accessible, we're more accessible. But if people aren't actually accessing it, then, or they're not engaging with it, we accessed it, but we didn't really get what you intended us to get out of it because we just sat passively and listened, right? And it reminds me a little bit of like going to see Irish dancers, and all you see are there. You know, there's some great stuff going on, you know, that you can't see, but if you're at the back, all you see are the heads, you know, turning this way, and like that whole body language, like moving around a room, and you know, looking at a book and saying, hey, I really like what you wrote there, or you know, that's really cool, can you mind letting us into that conversation? So I mean, for me, that's just all that connection stuff.
It's funny that you say that, because just this week, our youth facilitator, so our youth groups are here all day long, but so they have access to the room. And so during lunch, she just grabbed a bunch of board games, and she doesn't usually do that. She grabbed a bunch of board games and put it out for them to, this is the game of life or whatever. We use it metaphorically in our, and now they're all, the youth from our group are going out socially. You know, like if we were doing this online, would they have gotten that? They wouldn't.
Even in an in-person classroom. So my students generally work out of ILC books. So they're all in a room together, but they're all doing independent things. But when we would organize, let's go out on the land for the day, now they're sitting around a fire and the connection is completely different. Or like the board games you said, like they take a break, or we sit and we're going to do sewing, and so we're away from our books. So even just being in a room together doesn't necessarily do that so much as, and it's the casual stuff, it's the unplanned, like you said, it's not what I intended you to learn. It's just what happens when people are together.
So I just wanted to jump in. So one of the things I think about is just, and I think the lesson came out of COVID too, was really just the flexibility of services to go online versus in person. I'm thinking, for example, in disaster events, right? Where we have to switch to, you know, we have to be nimble in terms of, you know, what's available online, what's not. Say your internet cuts out, well, what happens, right? If you have a totally digital service that's being delivered, right? So those are, I'm just thinking about kind of that flexibility, as well as having, okay, well, what happens? Do we have a plan in place in order to make that transition between the two, and having those options are something I think about.
Yeah, if I can just go off of what Julie said and what's just being said. So Julie, you know, I've heard said that the meaning of a meeting only gets created afterwards in the discussions that happen post the meeting. You know, and I think that has a lot to say what you're talking about the importance of those gray spaces between spaces. And then to the comment that was just made about, you know, the online disappearing, I relate to that absolutely in the disaster scenario, but also in the environment where we are low in health human resource, and the virtual environment is being held up as the panacea to providing service to these remote rural communities. So I'm sitting in Toronto and I can service a fly-in community, you know, digitally. And what happens to the continuity, and more so the value of having people in place, and the value of place, that I think at least Western society is just starting to recognize, but in a really tangible way. If you want to talk dollar and cents, where are those people spending their money? You know, if you're going to enhance your community's economic environment, having professionals and people offline and not virtually elsewhere matters to the richness of your community and the community experience, and the resilience of your community when it becomes cut off from the rest of the world electronically. So really good, interesting points, I think.
Yeah, You know what? Also, too, one of the biggest fears that we have when we're doing group facilitation is that we don't always get to see everybody that's on a screen for whatever reason. The camera might be off, or there might be only this 5 here that's showing on my screen right now. But then I can see that there's 18 people that are on this conference call. My biggest fear was that if I don't get to see the interaction of the people that I'm giving this information to, I don't know which of those people are getting this information or might need to ask questions or want to interact, but they're too introverted. And as a facilitator, I need to know that to make sure that I am reaching everybody. So every time that I log off, that's always in the back of my head. Did everybody get the information that was presented? I can ask that question, but that doesn't help if the person still doesn't want to like put their camera on or join the conversation or whatnot, right? Watching Rachel, I could see that she was trying to jump in a few times, right? And there will be in that group, there will be people that will want to speak more than the others. And as a facilitator, we need to help facilitate that so everybody has that equal opportunity. So my biggest fear is always not being able to reach that person that is not getting that information, right?
And a lot has been said about relationship building. So it seems that digital would be the most effective if you already have built a relationship with a group and then or a person, and then you get together, digitally for a follow-up meeting or a follow-up conference. Say if you do, if you have that relationship beforehand, it seems like digital works well. NPI, for example, I'm just a moderator, but I just want to give a little example. So NPI, we have one office in Thunder Bay, we have another one in Kirkland Lake, and we have a satellite office in North Bay. So we work digitally all the time, right? Sometimes we have staff that comes and goes and doesn't meet the other staff in the other office because it's a 10-hour drive, right? So you miss on that relationship. But for example, if you already built that relationship, for example, if you already know that staff and you met them at many events before when we get together or something, then it flows better, right? Because you already have the relationship. So then the possibility of connecting online or digitally is perfect, right? So
I think there's definitely room for that. I think back to when my kids were teenagers and they played sports, and when you would host a team from another country, we would twin them. And then they would connect with those athletes from another country before they came here, and it helped build the relationship and sort of get it started and get it burgeoning before. So I think there's definitely room for that. I've been thinking about Julie's earlier comment that there are certain populations and certain people that it works for. And it does work in certain situations, and it does work for certain adult learners that have that ability, and whenever you have a facilitator that uses different modalities that allow the introverted, the extroverted, and the person who is more of a reflective reader and doesn't want to contribute on the spot. I mean, it works. We've probably all learned in that way. I think that where the discussion becomes really important is where the marginalized populations are impacted because of the fact that really, truly, that's who we should be focusing on. For those who it's easy for, that's great. That's wonderful. But I'm going to come back to the fact that when it comes to the youth, those in that early 20s that have struggled in the school setting, who are coming to us and really didn't work. And like Julie, we do the same thing. We send them horseback riding. We do these things that build confidence. You can't do that online. And how do we build equity? I'm in North Bay. I'm 2.5 hours away from, civilization where there's like a lot of like an urban center. But if, I went to Kenora for a week one day, and it's not the same, right? So when you're looking at that connectivity and that opportunity, we really do have to get down to, building equity in our systems.
And it's really easy for me as a teacher to just be like, it doesn't work. Like it can, but I resist it. I like connection. Like I'm as a frontline worker, I got into this because I need to be with people, right? But there are certain instances where it's fantastic, where we have a colleague who's working in Toronto right now, and so we popped on and had a quick Zoom with her yesterday, and I like that a little better than just talking on the phone. I like it a lot better than emailing back and forth. It provides opportunity to take students on virtual tours of the Louvre. Like there are some really cool things about it. Dr. Arancha, did I say that correctly? Sort of. Sorry. You had talked about, we're sort of looking at it as the panacea of, and I think that it's important to keep it as an option and one of the things that we can do or could do for certain things. But my fear is that there's this move to try to make it the thing, the main thing. Oh, since we can do it, we should be doing it all the time. We don't have to go into those communities anymore because we can do everything virtually. We don't ever have to meet in person. Let's save the money on planes and hotels and just always do it, and my fear is that I feel that there's this move to make it the norm as opposed to the option. And so I just needed to comment that I do think that there is a place for it, but I just don't think that it should be the thing all the time.
I was just going to comment that I work out of New Liskeard, but my job is based in Toronto. And so I'm very blessed that COVID opened up the eyes of government that you can work from anywhere. And so it's an opportunity to apply for a job that's in Toronto. But I'm really frustrated because for the first 10 months of my team that I worked on, none of them would turn their cameras on. When I finally went to an actual physical meeting, like I didn't know any of them other than their names, like, oh, that's who you are. And I was talking to another friend who's in industry, and their comment was that when they have online meetings, it's a fireable offense if you don't turn your camera on. And I've tried to implement that with government with little success so far, but I would say it should be.
I wonder if I could just jump in for a moment. I'm actually new to the NPI board. I'll try to turn my camera on. Just want to say that if we did not use technology in the way that we're using it right now, I actually would not be able to be on the board. I would not be able to get this information. So I think we kind of have a hand-in-hand thing where we need to have both be accessible. So I work with FSET as their communication and project manager. And one of the things that we do is work with Starlink to help close digital divides for remote and northern communities. And without that, we're having significant barriers and access to basic needs. Someone working in Kenora, such as I, coming from Southern Ontario, I thought, okay, well, there's going to be no more education for me, no more professional development because I'm going to be in a small town, not going to meet very many people. And yet I'm probably more accessible to the people of Kenora on 3 different boards spreading from Thunder Bay to here. I had a sick child in a rural community, and without kind of the local hospital working with even out of province hospitals, our lives would look very much different. So I don't know if it's maybe more of a business practice or an age thing where kids need to be in a more on-site environment to learn those skills that you speak about. Because I know that since COVID, I've been working remotely and still feel connected to teams and communities, but I have that base knowledge and understanding. Because as soon as you go into the workforce, a lot of it is technical, a lot of it is digital. You can't really get away from it, but as long as you have that foundation and human connection and skills, I think there's a way to manage both. I would like to be an example of that. But yeah, I just wanted to jump in, and this was a very good seminar so far, and I appreciate you guys hosting it.
Just a comment, if I may. Yeah, thank you. Good to see you, Julie and Vernon. Haven't seen you in a while. And kudos to you and your team and Seven Gens for doing what you're doing. I work with Anishinaabeg Employment and Training in Thunder Bay. We work with 9 First Nations east of Thunder Bay. And certainly to echo what Julie has said or said in between the lines, yes, it is a tool and certainly helpful for those that need that accessibility. And we too, we bought Starlink for each of the 9 communities to ensure that accessibility for students that needed to get their grade 12. And we do have graduation rates, we do celebrate that. But to underline what Julie and others have said, land-based learning is a better success rate with the students that we're dealing with. And we're funded under OTF to do a study for the next few years, and Zola's on the line as well as Adrian. And just to share a little bit of information, those that are 18 to 20 years of age that have been doing their education on reserve, and we know Beat to Gun, Nishnabek, or Pick River is an example where 80% succeed. When you look at that same age group off reserve, it's less than 30% succeed. So we know that if we look at examples of those that are doing well, even with outside of our 9 communities, they're using land-based learning, they're using that face-to-face. There are those students that can succeed and do well with the virtual, and there's a team of us that just came back from Connexus. This is a national event. They have 1,900 people that attended, and I know this is opposite, sort of opposite that we're talking about today, but AI is coming, and AI, it's been professed to affect education, probably one of the most areas that it will impact. So you have these avatars talking to youth. I mean, they say it's going to impact, whether it has success or not, we'll see, but it is coming, and it's going to be interesting to see how that will affect our respective fields, especially in the areas of workforce training too. Education and workforce training was the highest group that AI was going to impact. Anyway, I just wanted to comment and thank you for pulling this together, and yeah, thanks for sharing.
I just wanted to throw in a question for us, like the last few minutes. So 2 questions actually that you can discuss briefly. So we touched very quickly on the need to know the community, the surroundings people live, and the culture. So that difference between knowing that from a paper-based, information or online or digital information versus visiting the community. For example, if you were talking to someone, you know where they live, you know what their surroundings like, you see the relationships in that community. So that's maybe something that can influence digital service delivery too, because you're more likely to know the circumstances of that community and that person. And also, we talked about event attendance and how online event attendance is higher normally than in person because it's cheaper. For people don't have to travel, they don't have to take the time, for a drive or anything. But due to higher event attendance numbers, so the numbers you get per event actually means that you're getting a higher engagement of probably not, right? So that just having a higher number of registrations or attendance number to show at the end how much, right, some organizations are moving events online to have the higher number, but it may not mean you're getting the same results, right? So.
I'll jump in. I think it's going to depend on what your event is and who your target population is. I think that online events can really, right? You can get people from a lot of different places. And if it's going to be a passive event where you're just going to be, you have an expert speaker and you just want to speak, and then more is better. We actually, even in person, quite frankly, with marginalized populations, you got to keep the group small if you really want to be effective. So more is not better. Again, I'm going to come back to, we're here to have an impact, not to do a job, not to deliver. It's not transactional. It's not an activity. It's not a box to check. It's a life to change. And therefore, I often, I've said this on national platforms because I'm on advisory committees with IRCC, the word efficiency and how it is coupled with technology is a false correlation, because just because you can do it with more people faster, quicker, doesn't mean you're actually getting the outcome and the result that you want. So just for example, if I have a newcomer come into my office and I want to be efficient, and therefore I'm going to run him quickly through an activity, and then I send him out into the world, guess what? 2 months later, he's coming back, lost efficiency. I decide I'm going to serve him through technology this time, and I'm going to run him through some programs because I've decided this is the content I need to give him, send him out to the world. He comes back, lost efficiency. Efficiency equals money. But the fact of the matter is, doing it quicker, faster, easier does not save you money in the long run, and it really just dehumanizes the whole process. And it has to stop.
Leanne, I really appreciate your thoughts, and I think that we are kind of in the same. The last thing that I'll say today is during COVID, everything went digital. And so I started doing online yoga classes with the same number of people that I would be in a room with, that I knew, an instructor that I knew, and it's just different. I'm in my living room, you're not there, right? And just as like in terms of whatever the services that we're offering, it's just, we have to acknowledge that it's different, whether it's better in some ways or not in some ways. It is very different than being in a room with people.
And for sure, there are many positives, like everyone has pointed out, and it is very nice to have a very balanced discussion. With that, I'm very sorry, but I'm gonna thank you all for being here. It has been a great discussion. Thank you for the participation. It has been great to see people jump in and give their insights as well. And again, please feel free to connect after this meeting, online meeting is over, right? So please feel free if you really want to talk to someone. We can always ask if they want to connect, and we can connect you guys and keep this conversation going. We'll for sure be in contact with you again to let you know where to access the video. And again, if you're interested in continuing this conversation, we can always do that at another time. Thank you all for being here today, and have a great rest of your day.